Hello, it's Dr. Rhonda Johnson. Today's Saturday, May 14th, 2022. And today I'm doing 6 questions and 6 answers about the COVID-19 vaccines. Question number 1, I get this all the time. Do these COVID vaccines still work? Well, remember what they were designed to do. They were developed to protect against severe COVID disease, hospitalization, and death. And yes, they do that very well. Now, how long will their protection last? That's the million-dollar question, because we know that the vaccine immunity wanes over time, and there's so much virus out there and all these new variants. Question number 2, why does the immunity decrease or wane with time? Well, the answer is it has to do with how these vaccines work. They induce your immune cells in the white blood cell family called B lymphocytes or B cells to produce proteins called neutralizing antibodies, which circulate in your blood and serum. But these neutralizing antibodies lose their potency after 3 to 6 months, and that's why the vaccine protection wanes. That's the simplified version. Question number 3, why are there so many vaccinated people having breakthrough COVID infections? Well, you know that the vaccines do not keep you from getting infected. If you get infected and you are vaccinated, though, the vaccines kick in and help stop viral replication. We know this SARS-CoV-2 virus has what's called antigenic drift. So we're going to keep getting new variants, and these new variants are evolving to evade immunity from vaccines and natural infection. And people, our behavior is driving this because we all share the same air for this airborne virus. Again, masking, avoiding crowded indoor places with poor air movement for prolonged times, and practicing good hand hygiene and improving ventilation greatly reduce your risk of infection, whether you're vaccinated or not. Question 4, why can't we just keep getting booster shots? Well, vaccines do not carry zero risk. We know that the messenger RNA vaccines can cause a rare but serious complication called myocarditis and pericarditis. And the Johnson & Johnson vaccine caused a rare but fatal blood clotting risk that has caused the FDA to recommend discontinuing the vaccine except for in special circumstances. Question 5, what about herd immunity? Well, folks, we have it. The CDC says, well, almost 60% of adults have had COVID infection and 70% of American kids have had it. So we have a lot of immunity out there. Will it hold up? Will it protect us? Well, it depends on these new variants. Again, we know that BA4 and BA5, these new Omicron variants, have genetic mutations which evade immunity. Question 6, will there be an Omicron-specific vaccine? Now, I don't know the answer for that. The FDA Advisory Committee is set to meet in June. I do know there are various different Omicron-specific vaccines in clinical trials around the world. How close these companies are in terms of submission of their data to the FDA, I don't know. But I do know the FDA Advisory Committee is scheduled to review the Novavax vaccine, the Moderna vaccine for children 6 months to 6 years, and the Pfizer vaccine for children under 5. And they will also give recommendations on whether or not there should be an Omicron-specific booster for the fall and what strains they should be targeted against. That's a lot of work, but these are the top experts in the nation that will be meeting and giving recommendations. So I hope that answers your questions. As always, my views are my own. Stay safe and have a great weekend.